Welcome back to our attendees. Our next speaker, Mr. James Norman, Healthcare CIO at Dell Technologies, speaking on today's topic, Future of Healthcare, Role of Hybrid Cloud Computing for the Healthcare Sector. Over to you, James.
Thank you, and thank you for having me today. We've seen quite a lot of technology hit over the last 5 years. Lots of change happening in healthcare, lots of new technologies coming into the fray. With compute being pushed down to the edge, we're seeing a lot of computer vision, a lot of tools being placed out in healthcare settings, things like thermal vision, things like crowd control systems, population health management, and Bluetooth management and flow management systems. We're also seeing a big rise in data management and the need to make better use of the data that we're capturing. And the reason for this is because with wearable devices, with pushing healthcare out into the virtual arena and using applications, the amount of data that we're capturing is significantly greater than we have in the past, which means there's an onus on healthcare providers to take care of that data, but also gives a requirement to make better use of the data that we're capturing as well. And that's where we've seen this big rise in artificial intelligence. Now, artificial intelligence isn't new. It's been around for many, many years. However, with the advent of improved computing and reductions in the cost of storage, we've improved bandwidth for connectivity and the amount of data we're capturing. Now it's really starting to come into its own. And we're seeing the emergence of AI, not in the robot of the future, as was predicted 20, 30 years ago, but actually in decision support capabilities, supporting the clinician by things like pattern recognition in digital pathology, or the ability to crunch millions of data sets for genomics to understand where the biomarkers are. And now we're seeing this rollout universally of 5G and even 6G in some areas, which has enabled us to capture more data and send it over the airwaves. This means that care can be provided outside of the hospital. We're seeing satellite hospitals start up out in remote regions. We're seeing robotic care, things like the Da Vinci robot for surgical interventions being carried out remotely, where the team doesn't physically have to be on site, but consultants can manage the robots from anywhere in the world. And as previously mentioned by my fellow speaker before me, everything has to be underpinned by an increased focus around security. And we're seeing new tools to help bring the security along to make sure that everything that's going in now is protected and safe for use, because healthcare data is one of the highest target areas for criminal gangs. Now, of course, healthcare has changed and it will not go back to the way it was. COVID-19 has shown that we needed to take this broader approach to health and care, and that patients actually quite enjoy having access in this new way. Now, there was always this mentality that we had that we couldn't provide care outside the hospital environment as well as we could inside the hospital, or that we couldn't use remote tools and that we had to physically see a patient. And that mindset has now changed over the last 12 months. And what we are seeing is that in doing so, healthcare organizations are able to deliver a more integrated and less bureaucratic care that is improving access for patients. It's improving delivery of services, and we realise obviously that there are some elements that just could not be delivered remotely. But the reality is, what we have learned through the pandemic, we need to capitalise on that, and we need to make sure we take forward what worked and what worked well, and continue to build on it. What didn't work, fine. Yes, we put that to one side. But this integration of systems has meant that patients have been able to see physicians sooner in their own home care environment or care home. They've been able to get access to remote services, and it means that they've been able to feel assured that their needs are being looked after. And this needs to continue, but it also needs to improve. Now, the goal that we are seeing for all healthcare environments on the back of this is to join all the different services together so that there is a seamless handoff of care between secondary and primary care, right through to social care and management of the patient out in the community. In some areas, these have been called integrated care systems. I know that each country has a different terminology and a different approach, but essentially there's three key areas that are being focused on, which is looking at data captured across the population, to use that data to analyse where care needs to be provided, where the focus of investment needs to be, that because of increasing demographics, and to make sure that we're improving patient outcomes, and also to make sure that all the investment is going in the right area, so we're getting value for money for taxpayers. You know, we've all seen this massive increase in expenditure at country level, fighting the pandemic. Now we have to take responsibility for how we're going to reduce those debts, but at the same time not reduce the provision of care. And all of this is happening alongside simple challenges across the health and care system. We've been seeing a growing and aging population for many years. And over the next 20 years, the world's population is expected to grow by almost 10%. And the number of patients aged over 75 is expected to grow by almost 60%. This means you're going to have more patients with comorbidities living longer, needing treatment longer, and consuming services longer, which means increased cost and increased complexity of care. And this demand for healthcare is rising. If we take the UK, you know, before the pandemic, we were already seeing in the year up to 2020, over 25 million A&E attendances and over 308 million general practitioner appointments. Now, this has just been compounded by the pandemic, and the demand on services has just continued to rise to the point that healthcare services have been on the point of collapse for the last 12 months. Hence all the emergency provisions put in place to try and reduce the demand on healthcare. But this growing morbidity and complexity of disease is going to continue. You know, the proportion aged over 65 with 4 or more diseases is set to double by 2035. And a third of these are expected to have mental health problems as well as underlying healthcare problems, which COVID-19 will have continued to contribute to this trend. Long COVID is still being understood, but every day we're finding more and more conditions connected to it, and the underlying mental health aspects have yet to be understood. So there needs to be a readiness for what's next amongst healthcare professionals. We know that patients' expectations are changing, and we know that this is going to have to continue with the right investments to accelerate digital transformation, because the way that clinicians are working and the way that we're seeing patients is changing. So having that transformation in the digital clinical workflow to do that handoff of care in a safe, secure manner that reduces complexity and reduces delay in the care is absolutely essential. Likewise, we've already seen this investment in virtual care, but we need to build on this. We need to keep patients safe, but we also need to keep our staff safe. And the way to do that, and also improve access to the patient, the ability to monitor the patient, is through virtual care. And it's only by adopting these and bringing these into the care pathway that we'll be able to recognise the value of this, to identify new clinical realities where we can find this balance to keep patients out of hospital. Now, if we take virtual care, for example, patient care being delivered anywhere and any time, there's a complexity around this, whether that's providing ICU care, your intelligent alerting or remote diagnostics, or whether it's a primary care management system connecting the patient where the patient takes charge, right through to providing augmented reality and virtual reality surgery for clinicians anywhere in the world. Likewise, with patient monitoring, the ability to capture data on the patient in the patient's home and healthcare setting, whether that's a care home, whether that's in the work environment, or just whether that's walking around in their normal environment, is absolutely critical because it gives a realistic picture of what's happening to the patient. But it brings a challenge as to how do you capture that data. We know from cases where we've studied this data that it improves patient outcomes by being able to monitor them in their own home environment. Clinicians are able to make appropriate diagnostics, but to do so gives a real challenge to healthcare professionals because it means the infrastructure has to be right. It means the software has to be right. And all that requires a modernized technology solution approach where you're focusing down on how you're going to capture that data, whether that's over a cloud, a multi-cloud, a private cloud, a hybrid cloud. All of these need to be understood in terms of your strategies and approach. And you need to make sure you've built up a baseline infrastructure that this can sit on. You also need to factor in what are the high value workloads that you'll be working across this cloud environment. Is it access to an electronic medical record? Is it medical imaging? All of these have different bandwidth requirements, different complexities as to how the data flows, and different messaging. So in Dell Technologies, we help to bring stability where you have all these disparate sources of your data, whether it's in the community, in the home, in the hospital, whether you're working with Google, Alibaba, Microsoft Azure, Amazon Web Services, VMware, vCloud, VirtuStream, or whether you're working on premise. You have data spread in multiple areas. And what we do is we help to bring a consistency across that, where we bring all the data together and we connect it so that as an end user, it's seamless access to it. So it doesn't matter about where your application sits or whether it's a legacy application that was designed to run on an Oracle database or a DB3 database and actually cannot work in the cloud, or whether it is a cloud native application that was designed on S3 to work natively in the cloud, taking advantage of containers and Kubernetes for managing all those containers. It's irrelevant. What you need is an ability to bring all those together. And within Dell, what we've done is we've created a series of tools that support the end user to grow their business, to take advantage of these services, and also to create a single marketplace where you can bring in new AI tools, where you can bring in management tools to be able to see how staff and patients are utilizing cloud services, to be able to keep a track of the data and understand how it's being used. And there's multiple areas where this can take place, whether that's through image management, bedside care, through increases in research and development for genomics, or just simply capture for healthcare IoT. And when we look at applications, there is this complexity that we need to eliminate through the management of the data within the hospital and the management of the data on premise and outside as well. So to do so, you need to have a data first cloud smart strategy. And what I mean by this is understand the data and requirements. What type of data? Where is it coming from? Where did you create it? The security requirements. How long are you going to retain it? How fast is it going to be needed to be pulled back? Is it transactional, or can it be stored in a cloud archive? Does it need to be in the cloud or near to the hospital or sit in a private cloud? And it's only by understanding these will you be able to truly identify how a hybrid or even a multi-cloud framework can support your needs. And at Dell, we've helped create this multi-cloud framework to save you from having to go through the design phase. We've built out the series of solutions that all integrate together to deliver all your needs right through from the hardware up to the software stack and the management tools, and basically to create this full capability that has been pulled together by VMware so that you've got a virtualization capability to work across any cloud provider and to be able to work on-premise, connect all of your data, have a single pane view of management so that you don't have the complexity of having to manage across all of these types of cloud providers, but you can reduce the risk of where the data sits and also the complexity of moving that data and providing care outside of the hospital environment. We built out a partner ecosystem to support you so you don't have to do this. Working with Dell Technologies, we will bring all of your cloud and hybrid cloud requirements together, from moving to the cloud, the strategy, securing it, and being able to take advantage to improve healthcare. Thank you very much for today. I know that was a whistle-stop tour. 15 minutes isn't long, but I hope you got a feel for how Dell Technologies can help you in your move to a hybrid and a multi-cloud, taking advantage of the tools and the strategy that we can bring, and also how it can be implemented in healthcare to improve patient outcomes. Thank you.
Thank you, James, for your presentation. All the questions will be forwarded to you and you can reply to the clients directly.